Tonight we investigate hospital safety in Virginia and the shocking number of people caught trying to bring weapons into the emergency room. For years, healthcare workers have faced violence in the workplace.
Yeah, but this issue is especially relevant now after last month's murder-suicide inside Riverside Regional Medical Center. I went to a lawmaker and local hospital leaders to see what's being done to make sure a tragedy like that doesn't happen again.
How you doing? You'll just put everything right here for me?
Anyone entering the emergency department at Centera Norfolk General must first pass through this.
Sir, how you doing?
Go and step forward for me.
That's a new concealed weapons detector.
All right, anything in your right pocket?
And it's powered by artificial intelligence.
Are you checking in or visiting?
It utilizes AI to recognize the consistency and the shape of a weapon.
Stephen Hollowell oversees security at all Centera hospitals.
Unfortunately, firearms within hospitals are more and more prevalent, shootings within hospitals.
Any pepper spray, tasers, anything like that?
Centera installed the new weapons detectors 20 months ago at Centera Norfolk General and Centera Virginia Beach General.
Any pocket knives or anything on you? Go ahead and walk on through.
They've since stopped nearly 2,500 weapons from coming in, including 1,200 knives, 64 handguns, and 2 machetes.
A multitude of martial arts weapons, believe it or not, axe, crossbow, so it kind of runs the gamut.
Go ahead and walk on through, please.
The goal, they say, is prevention, not prosecution.
Anything else on you?
After all, in Virginia, there's no law regarding weapons in hospitals. Delegate Phil Hernandez of Norfolk wants to change that.
Provision, we have laws that apply to schools and courtrooms and other sensitive areas, but nothing directly for hospitals.
Hernandez introduced a House bill this year that would make it a misdemeanor to bring a weapon into a hospital. It passed in the House and the Senate, mostly along party lines, but the governor vetoed the bill in May. 10 days later, an armed woman went to the 4th floor of Riverside Regional Medical Center, shot and killed her husband, then herself.
It seems like a lot of times we wait until tragedies happen and then we're like, oh, well, we should focus on this problem. This bill was an attempt to get out ahead and to make sure that we don't have situations like what happened at Riverside, or frankly any future ones that, God forbid, they happen in the future as well.
Riverside Health installed metal detectors in the emergency department after a patient stabbed a nurse there in 2021. Those metal detectors last year intercepted more than 2,000 knives and 60 firearms. But the president and CEO of Riverside Health tells 13 News Now more must be done. Now they're evaluating whether to invest in new weapons detection systems like those using AI. At Centera, they're spending the next few months installing these concealed weapons detectors in all 12 hospitals. They've also added a new badging system for visitors. And right now, dozens of their security officers are undergoing training to carry a gun.
I think we have really put a good system in place. Does it mean we need to relax? No, we need to completely continue upping our game.
Healthcare workers are 5 times more likely to be injured at work. Centera says these changes are already reducing workplace violence. And as for Riverside, they've spent the last few weeks getting safety feedback from their workers. And Janet, I'm told they're now making immediate updates to some of their security plans there.
Okay, well, what about the failed legislation when it comes to guns in hospitals?
Right, so hospitals can already ban weapons, but that bill would essentially make it a misdemeanor if you were caught bringing one into a hospital. Delegate Hernandez says he'll try to pass it again next year, even if it means tweaking it a bit to get the support it needs.
All right, we'll see what happens then.